good morning and good evening to all of you in India. My name is Admiral V.K. Singh. I'm a doctor by profession, heading the Navy Medicals in Bombay before I took over other things and quit my uniform. I have started International Institute Health Management Research in Delhi as a founder director, and after that I decided that I should be really into the healthcare innovations and try to do that. Published 3 books in USA, and the first one got international award and got Indian edition adopted by IIM. I am thankful to the CAHO, which I am really considered as a part always. Dr. Vijay has been always very close to me, and the good job is being done by the CAHO, Dr. Vijay, and the people around. A word of caution I would like to give. I was here only 2-3 days back in Columbia University, and ultimately found 250 odd innovations are being incubated. A word of caution when I teach in IIM and IIT, I would like to give that what you have done till now, till today, your presentation, is only half job done. After that, if you really want to monetize or otherwise, out of the total, the success rate is not more than 15%. It is that 15% which will come up. The 15% is the one which you should consider, and the people always do, but do think of your failures, and those are the 185 odd percentages. You must learn from the failure. I would now get back to the presentation part of the presenters. It is something which really I congratulate all 5 of them who have come all the way, and CAHO has already selected them for doing. Now invite my next team is KIMSHEALTH Surgical Sponge Tracking.
A very good evening to everyone. I am Srini Venugopal. I'm the Group CIO of KIMSHEALTH. And first of all, a big thank you to CAHO for shortlisting our tech innovation in patient safety. We are very honored and quite excited to be here to present this to all of you. If we look at the background or the business case that we try to solve, surgical sponges are left inside patients during surgery, and that is a major medical concern. This has been voiced by WHO as well as other global organizations and studies, and that leads to a lot of discomfort and complications for patients. Global statistics reveal that a surgical sponge is left inside a patient in 1 in 6,000 surgeries, and that's a staggering amount of risk and danger that we present to patients who come in for a surgical procedure. Right? And it's not just global numbers. When we look at our own hospital, in the last quarter, we saw 3 cases that were presented to us with abdominal distension and fever. And on investigation, we found that these 3 patients had retained surgical sponges in an operation that they did elsewhere, not in our hospital, but an operation that was done elsewhere. So we had to operate them and rectify that issue. So it's not just global numbers, it's something that happens very much in India. And why does that happen? And the current process of accounting for surgical sponges is manual counting, where someone counts the surgical sponges as they come into the OT and once the operation is completed, and that is prone to human errors. Longer and more complicated surgeries can, of course, run through packs of surgical sponges, and that exponentially increases the risk just by the volume of sponges that are used and the amount of time it takes to do manual accounting and counting of that. And it's quite dependent on the OT staff's diligence and experience in making sure that everything that goes into the theater is accounted for when the patient is closed and the operation is complete. And as we all know, retained sponges can cause pain, infection, and a lot of other complications for patients. And we felt that there was a dire need to solve this using technology. So we looked at within our technology scope and we tried to think, how can we use technology to solve this problem of patient safety? So what we did was quite simple. We try to look in the market and see, are there any existing solutions that we can use? Or are there any solutions provided by vendors that we can use? But we found that no other hospital, at least in our research, is using such a solution, for a technology solution for surgical sponge tracking. And so we pioneered this for the first time in India, a patient safety initiative that leverages technology to prevent such occurrences. And what we did was we digitized and automated this process of identification, monitoring, and tracking of surgical sponges. The solution itself is quite simple. We implemented barcoding for unique identification of surgical sponges and the packets that they are held in. And this happens before sterilization. So you can see an example of some of the barcodes here. And then these sponges are scanned in just before the surgery, both the packs as well as individual sponges into the software, as you can see in the screen here, and then you see the equipment that is used for the tracking. And after the surgery, before the patient is closed, these sponges are scanned out post the surgery and before you close the patient. And we need to make sure that these both tally. So that results in this error-free and accurate tracking of every sponge that enters and exits the OT. In terms of the process itself, the process is quite simple. I'm just depicting the flow in a very simple manner here. The sponges, as they come into the OT, are scanned in, and so we have a tally of what we are using. And after the surgery, these sponges are again scanned out, and as you can see here on the picture, it shows the total number of sponges that were used and whether they were used or whether they were unused. So that's captured in the system after the operation. And how does that help us? I mean, what are the advantages of having such a system in place? It improves safety of every patient that comes into the OT, and that is absolutely phenomenal from our perspective. And that makes sure that we are, having the right diligence in terms of that safety of patient. It completely eliminates human errors because there is no more manual counting. There is no more spreading out sponges to find out what went in, what went out. It reduces time, which is quite significant because it allows surgeons to close the patient more quickly as they are not waiting for a manual count and recount. We have seen in our experience that around 15-20 minutes is saved per patient. That kind of frees up the OT quicker, as well as it reduces the time that the patient spends on the table. It's a very cost-effective solution because it's barcoding. It does not take a lot of equipment to do this. And from a technology perspective, the implementation is very easy. It is in a SaaS or a software as a service model, which means that it is scalable and it can be quickly deployed into other operation theaters, into multiple OTs, as well as to smaller centers. You don't need a lot of complicated technology to run this. And what we are doing currently in KIMSHEALTH is that we are taking this solution model and we're looking at extending it to other OT equipment, as in OT equipment as well as consumables that are used. In order to ensure that all of the OT equipment and consumables are accounted for before and after the surgery, including doctor timeout, call out, etc. In fact, we're looking at building that complete OT safety solution as a module that we intend to implement at our hospital. When we looked at the global market, we found that around 15% of American hospitals use similar tracking technology, and all of them have said that they have credited this system with eliminating the retained sponge surgical errors entirely, completely, and that's a great thing to know. And in India, we are the first hospital to pioneer this, and we are quite proud of this. And this is a technology that we see will be very useful in ensuring patient safety in our hospital and elsewhere. So, thank you.
Thank you, Mr. Venugopal. And the presentation has come very apt at the time when WHO is celebrating the Patient Safety Week. And this is the time where, and secondly, a common problem, how you have tackled it, because quite often, if this is this is being left inside, it is not only a slur to a hospital or a patient, but it goes into press media, and any hospital will be highlighted for a bad reason. Though it is one of the common things can happen as the statistics given by you. So a common problem, how it is handled and how it can be avoided, good for patient, good for the hospital, and not getting a track of the bad name of the hospital. Anyway, thank you very much. I now thank all the 5 teams. They have done a wonderful presentation, work, and in something which has been brought out.